If you classify implants, basically there are three types. One is endoosteal, one is subperiosteal, and one is transosteal.
নমস্কার 24/7 তাজা সমাচারের সমস্ত দর্শককে এবং পাঠকদের জানাই অনেক অনেক শুভেচ্ছা, ভালোবাসা। খুব ভালো থাকুন, স্টে টিউনড, অল দি বেস্ট।
24x7 ताज़ा समाचार के पाठकों के लिए मेरी तरफ से हार्दिक शुभकामनाएं।
Hi, this is मधुर भंडारकर and आप देख रहे हो 24x7 ताजा समाचार। Best wishes।
Hey guys, welcome back to the channel. You're watching 24x7 Taza Samachar. This is Dr. Madhurima Nanda, working as a doctor in Namita Nursing Home and Batapur City Diagnostic at Ichhapur. So today we have a very important person coming over in our clinic. So let's welcome Dr.Harshvardhan. He's an assistant professor in the Department of Oral Medicine and Radiology at Haldia Institute of Dental Sciences and Research. Sir, welcome to our channel.
Thank you. I'm happy to be here.
So today we will be talking about one of the most famous topic of dentistry, which is implant. So sir, can you tell me something about dental implant?
Yeah, dental implant nowadays is one of the most trending subjects in dentistry. It basically combines a multi-departmental approach which combines prosthodontics, crown and bridge, which also takes periodontology, and it also takes oral surgery. So it's a multi-factorial and multi-departmental approach. Basically, the implant thing came into our dentistry during the 1970s. Okay, the studies were going on in Sweden by Professor Brannenmark. He was doing studies regarding implant and regarding osseointegration. Osseointegration means when the implant is placed inside the tissue, how it is getting attached to the bone and how long it can stay there. Coming to India, it took a bit of time. Okay, it took a bit of time because, in my opinion, the sources and the courses were not too much up to date regarding implant. But now it's a booming industry, even in West Bengal, particularly in Kolkata. I know a few doctors from my own college at Haldia who are practicing implant and are practicing it in a very good way. Now the thing is, where do we use implants? Okay, where do we use implants means it's not like any patient comes to you, you are going to give him implant. Yeah. It's not like that. First and foremost, you need to have an edentulous area. So for the viewers, I'd like to say edentulous area means je jagah daant hoy na. Okay, jahan pe daant nahi hai. Okay, so that is your edentulous area. But the second thing again which is important is the patient should have a good bone support. Without a good bone support, you are not going to have a very long lasting or very efficient implant. Okay, so this bone support is very important. I'll be discussing about it later on. And the second thing which you can see, if the patient has been using some sort of prosthesis means, like in our dentistry, it's basically two types. One is removable and one is fixed. Removable মানে যেটা আপনারা খোলা পড়া আর্টিফিশিয়াল দাঁত বলেন, আর ফিক্সড যেটা ফিক্সড থাকে। ওকে, ডাক্তাররা ফিক্স করে দেয়, আপনারা খুলতে পারবেন। Now if the patient has used those type of prosthesis and it has failed, or the patient is not willing to go along with those prosthesis, in such cases implant can be done. Now the second thing, where it should not be done. First and foremost, being a doctor, I should tell you always that for poor patients, don't force them to do implants because it's a costly affair, and that's one of the means, I won't say negative criteria because materials se daam hoy, materials ka daam hai, so I won't say it's a negative criteria, but it's one of the setbacks. We cannot provide it for everybody. Okay, even in the college setup, it's costly. And in private setup, it's definitely costly. Second thing, If the patient has any kind of acute illness means if the patient has any kind of bone disease, okay, if the patient has any kind of your metabolic disorder which affects the bone, which affects the teeth, like for example, if you are getting a patient with rickets, which is basically due to your difficulty in the metabolism of vitamin D3 and calcium, basically deficiency of vitamin D3. In rickets patient, you are not going to allow implants. Okay, if the patient is severely diabetic, if the patient is diabetic, the patient is going to lose its bone support. The healing won't be proper after surgery, so it's better to avoid in uncontrolled diabetic patients. And also acute illnesses. Acute illness can be any kind of illness. Okay, if the patient is acutely ill, even like the patient is having typhoid, at that time you don't have to do implant when the patient is having typhoid. Let him heal, and after that you can do. If you are doing the implant at a area where you are seeing formation of abscesses, okay, don't do an implant. It is also a kind of acute illness. If the patient has a history of space infection in that particular area and which has not been drained properly, don't do implant. Okay. And now the thing is when to do and when not to do. Okay, case selection, that's the first criteria, and that's very important, that when to do an implant and when not to do an implant. As I already said, I'll be discussing about it. There are 4 types of bone basically. Means in layman language, if you say, if intraorally we check, we have 4 kinds of bones, and this has been given by one of the founding fathers of implant, jinar boitaও আছে implante. His name is Dr. Carl Misch. Okay, now this guy has classified bone into 3 types: type 1, 2, 3 and 4. Now type 1 and 2 contains your cortical bone, okay, and type 3 and 4 contains your trabecular bone. Generally in the field of implant, when the patient is having type 3 or type 4 bone, which is basically your trabecular bone, type 3 is your coarse trabecular bone and type 4 is your fine trabecular bone. In such cases, you have to have some idea as to how to do implant in such cases. Like, you have to have implant of certain diameters. You have to cut the bone in a proper way. You have to see about the healing portion. Means if the patient is having type 3 or 4, it's not like implant cannot be done. Implant can be done, but extra precautions should be taken. Otherwise, there will be failures. Okay, there will be failures. So for type 3 and type 4, we will generally be taking like small diameter implants are taken. Okay, like 3 mm is the optimal size for such bone. Okay, 3 mm is the optimal size. Second thing which you can do is, when you are inserting it, you have to cut a portion. Okay, the diameter of that cut should not be more than the diameter of your implant in type 3 and type 4 cases. It should not be more than that. Regular follow-up should be there. Bone healing, and in fact your tissue healing should be checked. And regarding all this, you should check it radiographically as well, that the bone strength is good or not. Okay, you have to check for any kind of infections which are occurring there or not. If nothing is occurring, it's fine, then the implant will be okay. Because in type 3 and type 4, as I said, since the bone is a bit weaker, trabecular bone is a bit weaker, you have to take a bit of extra precautions. Okay,
So sir, tell me, what are the types of implants?
if you classify implants, basically there are 3 types. One is endoosteal, one is subperiosteal, and one is transosteal. Endoosteal means there are 2 cortical plates. Okay, if you see the alveolar bone of our socket, alveolar bone মানে হলো ওই হাড়টা যেটা আমার দাঁতকে ধরে রাখে. Okay, if you see that alveolar bone, there are basically 2 portions. One is your buccal portion, যেটা বাইরের দিকে থাকে. One is your lingual portion, যেটা ভিতরের দিকে থাকে. Similarly, upper-এও same, বাইরের buccal, ভিতরে palatal. Okay, যেহেতু palate আছে. Now, your endoosteal implant will only pierce one cortical plate. Okay, one cortical plate. Next, coming to your subperiosteal implant, here the whole thing is placed beneath the periosteal layer. Okay, boner bhag hoy na, periosteum, endosteum, to periosteal layer er tolaয় placement ta hoy. আর transosteal যেটা আছে, that is both the cortical plates are pierced. Both the cortical plates are pierced. All three are used, but generally endosteal is more preferred.
Okay.
Endosteal is more preferred because it is easy to work with. Okay, and the material can be anything. It can be metallic, it can be ceramic, it can be polymer. Okay, so metallic, I mean stainless steel. Okay, now if you are coming to another metal, there is titanium. Now titanium implants are kind of the best implants. Maximum people who are doing implantology, who are practicing implantology, in most of the cases will prescribe or provide the patients with titanium implant. Reason being, titanium is a very inert element, does not undergo too much reactions. Okay, and because other elements can be a bit reactive, so it's an inert element. It is very much biocompatible with our oral cavity, because there are other materials of dentistry as well where titanium has been used, so it's very much biocompatible, and the patient gets an implant which is very long lasting because it is sturdy, it has strength. So that's why your titanium implants are used more and more. Now there is another implant which is basically hydroxyapatite implant. The advantage of hydroxyapatite implant is that it helps in the formation of bone around the implant. মানে তোমাকে আলাদা করে কিছু করতে হবে না, এর মধ্যে নিজস্ব প্রপার্টি আছে, হাইড্রক্সিঅ্যাপাটাইটের নিজস্ব প্রপার্টি আছে, that it will induce the bone forming cells which are known as osteoblasts to form bone around the implant. Hydroxyapatite implants are very long lasting. Why? Because when you have placed the implant, the bone will form around the implant and it will hold it for a very, very, very long period of time. Okay, it's a bio-inert kind of implant. But still, day-to-day implantology, titanium is still the preferable choice of substance. Okay.
So is the procedure like very painful?
No, the procedure is not painful as such. As I told you initially, it's a multi-departmental approach, and it takes oral surgery. Okay, surgery means katakuti hobe. Okay, you have to cut.
Yeah.
When we are cutting, the patient should always and always know that we are not monsters. We won't be cutting the area without providing some kind of anesthesia. So basically, local anesthetic medications are used. পেশেন্টদেরকে বুঝিয়েও দেওয়া হয়, ইনফ্যাক্ট বলেও দেওয়া হয়, the nerve blocks are given, whatever adequate nerve block is needed at that particular amount of time, and the procedure is generally painless as long as the local anesthesia effect is there. And even after that, if the procedure is going on, since it's a multi-factorial approach, we will be providing the patient in the meantime with proper antibiotic prophylaxis and analgesics, painkillers, so that patient is having as much as less amount of pain. So it's not such painful process. Okay. And it is not it's not very complicated. Once you understand it, it's not that complicated, because people who are practicing it, they are doing all the steps on their own. If you are doing it in a college setup, yeah, it becomes a multi-departmental approach. All three departments will work together. But if you are doing it alone in your chamber, in a hospital, then a single person is doing it. Okay, so because I know people who are doing it alone, so it's not a big deal. But people who have practiced it for long can do it alone. So patients can be relaxed. You can get implant and it's non-painful. It's not a big problem. Pain is not a big issue.
Okay. So what are the contraindications of implant?
Contraindications, as I told you, your acute illness, any kind of metabolic disorders, uncontrolled diabetic patients. One more thing, if the patient is on pacemaker,
Okay.
Please
We
don't
can't
use
do it.
implants.
Yeah.
Please don't use implants because that will mess up the pacemaking. Your pacemakers. Okay, that will mess it up. Failure of implant. One more reason is where are you placing it? Okay, there are times when you have to place it a bit angulated. Okay, softwares available which will tell you at what angulation you have to place, how much length you need to place. They'll tell you everything. There are softwares available. People are using those softwares. So these angulations, suppose if there was an area in the oral cavity where you have to place the implant in a bit angulated direction, but you place it straightforward, that will pierce through the bone, that will fracture the bone, and that will result in implant failure. Implant failure again. So these are the things one should keep in mind before practicing or learning implant.
So tell me something about oral welding and V3 implant technique.
Okay. V3 implant is not basically a technique, it's a type of implant. Okay, and intraoral welding is a technique. Okay. Now, intraoral welding is a technique which we used in immediate loading kind of implant. Immediate loading means we are placing both the implant body as well as the abutment at the same time. We are not doing it in multiple days. We are doing it on the same days. What we do is in intraoral welding, with the abutment, with the upper portion, the main area of the implant, we fuse titanium with it. Okay, by the process of welding. গাড়ির welding হয় এরকম welding instrument এখানেও use করা হয়. Okay, basically what we do, we fuse that abutment with titanium. Now what happens by this, the implant becomes more sturdy, it will have more strength, and it will heal very rapidly and in a very good way, and it will be very long lasting. The process came into fruition in near about, I guess, 1976 or 1977. Couple of guys were working on it, I don't remember the names, and they only brought this thing into fruition. And they basically, what they did, that they applied this titanium in the form of wire. Okay, nowadays what does happen, the titanium bars are fused or welded with the abutment of the implant. Now there are 3 stages of that. First is preparation, second is welding, and third is cooling off. Okay, now the most important in this is when you are applying the welding apparatus, copper electrodes are there, you have to apply it in that area. The first and foremost thing that you have to maintain for the whole procedure is firm pressure, so that no gap or space is there. And if you apply the appropriate amount of pressure, then it becomes more and more strengthful. It has more strength, it becomes more sturdy. Basically, it's done in 3 stages. One is your initial preparation, then there is a welding, then there is a cooling off. And as I was telling, that in the whole procedure you have to apply a firm amount of pressure so that no gap is there. And this no gapping thing, it allows the implant to have much more strength than usual, and it will last for a longer period of time. Okay, so the temperature at which the welding is done is your near about 1678 degrees Celsius, to be exact, 1678 degrees Celsius. Even when in the last stage it's cooling off, you have to apply the pressure during that area as well, because when the substance is rapidly cooling after heating, it might break into crystals. If you have applied the firm amount of pressure in that portion, then that crystallization does not occur and it does not break. So basically this is your intraoral welding technique. You can use it is done via 2 methods mainly. One is electrical and one is laser. Laser is mainly preferred over electrical because it has a better control and it provides a better source for welding. Okay, so lasers are a bit more preferred over your electrical ones. Well, that's your intraoral welding. And this V3 implant, it's a new kind of implant basically. And what happens is you get custom made abutments of different shapes and sizes. Okay, and it has some amount of space for the gingival region where This is basically used in patients with very thin gingiva. Okay, the gingiva is not that thick, it's not that strength, it's not having that kind of strength. Then very thin gingiva, in these cases you use V3 implants. Basically, why do we use V3 implants in those cases? It has some space where it helps the blood to flow, the blood to pool, okay, and it helps in formation of blood clots. Now, since it helps in formation of the blood clots, there is proper healing in that area, which would not have occurred had you used something else. It causes proper healing, and that's why the implant will have a longer time period and better strength. So that's the V3, because you get custom made abutments here. So this mainly due to this blood clotting mechanism, which it helps in. V3 implants are used nowadays.
What is the cost of implant? I mean, approximation of cost of implant.
See, the cost of implant varies from region to region. If you say, it may start somewhere between 50,000 and it may go up to 3.5 lakhs per implant. Okay, per implant. I'm not saying the full mouth implant, but per implant, somewhere between 50 to 60,000 to up to 3.5 lakhs. Okay, different people are charging different. It also depends upon the type of material you are giving. Of course, titanium will cost more than stainless steel. Stainless steel implant will be cheaper. Titanium implants will be costlier. If you are using bioactive implants like hydroxyapatite, that will be even more costlier. So it depends upon the type of material you are choosing. Second, it will depend upon the region you are in. Okay, because obviously if you are doing it in Maharashtra, especially in a city like Mumbai, it will be costlier. It will be costlier than Kolkata. And so it varies from region to region. Even if you're doing it in a college setup, they will charge you somewhere around 10-15,000, which is much lesser.
Yeah.
But 10-15,000 even in a college setup, you will have to be giving them. And it also depends upon the number of implants you are having. Somebody gets a single tooth implant, somebody gets full mouth implant. So that will vary. Okay.
One last question is, what is the time taken for this whole procedure?
See, time taken for this whole procedure will also vary, because some people still do the classic two-stage process. Okay. Now, when you are doing the two-stage process, after doing the initial surgery and placing the screw of the implant, you have to leave the patient for healing. Okay, if you are doing it in maxilla, that may be from somewhere between 3 to 4 weeks. If you are doing it in mandible, it should be somewhere between 3 to 6 weeks. And after that, the second stage will occur. So if you go through the classical method of implantology, that's a two-stage technique. It will take you somewhere around, completing the process, it will get you somewhere around, keep in mind, 2 months. Okay, 1.5 to 2 months. Okay, it may extend a bit if there is some complication in between, but on an average, it's 1.5 to 2 months. But nowadays, there is an immediate loading technique, which I was talking in intraoral welding technique. If you are doing immediate loading technique, it's somewhere, it's over within a month. Okay, it's over within a month. So it depends upon the type of method you're using. Okay, basically people still go with that classical approach because it gives you better healing time. Okay, you're leaving the patient to rest, leaving the tissues to rest, so it gives you a better result.
Thank you for the interactive session. So keep watching 24/7 Taaza Samachar. Thank you.